Well, Dr. Mohammed Munir is a virologist with Lancaster University here in the UK and joins us now. Welcome to you. What do you think the significance is of the fact of the first death outside China? Is it a significant moment?
Well, with this particular death, it's not really a significant thing, because when I was looking onto the report, that person has two other underlying bacterial infections which were lethal on their own. So if we consider the Wuhan coronavirus could be one of the causes, it would be pretty challenging to really identify which one was the cause of the death in the real sense. However, it doesn't really make big difference, especially because we know the virus is circulating in many other countries and the person-to-person transmission is possible, and the virus has potential to cause mortalities and death. So in this case or in future, these are unlikely events.
And Dr. Munir, do you think that other methods, other measures could be taken to try to slow the spread of the virus, or is everything being done that can be done?
No, not really. I mean, there's so many other things need to be done. Those are not being deployed at this moment. All our preparedness is really in the developed countries. Developing countries are having very little infrastructure. They don't really have a basic infrastructure now, only just looking for the thermoscanning or having any screening assay in the countries. So definitely the weaker economies or thin economies are at greater risk, especially now we are seeing the cases being reported in those countries.
Right. So that would set alarm bells ringing for you if significant numbers of cases are reported in countries where there are very poor healthcare systems.
Yes, in those countries, the containment would be really difficult, especially because of the poor infrastructure, lack of awareness, and overall lack of facilities. If disease go on in those countries, there would be a lot more impact than what we are seeing either in the developed country or back in China.
Very briefly, China has been saying for some time that it expects the outbreak to peak in a few days' time. Do you agree with that assessment? China has put a lot of efforts to really contain the infection. In majority of those efforts, those been put in place, those were certainly late. Therefore, the impact is increased. I am not in an agreement with that the peak will be in few days. There a lot more need to be done in China, even especially on the reporting system, and really to assess what efforts are being put in place and what are working, what are not working, where the virus is originated, how much is the virus mutation. Until we define all of those parameters related to the virus, it's really difficult to assess when it would start getting better before we really reach to the peak. Okay, Dr. Mohammed Munir, we really appreciate your time. Thank you very much for joining us, virologist from Lancaster University in the north of England.